Welcome to Smart Patient Mobilization Training, working with the low air loss support surface and repositioning sling, tips to keep staff and patients safe. Key points. This video will demonstrate safe work practices to employ when working with a low air loss surface and the mesh repositioning sling. Always assess the patient's mobility level to determine when it is no longer necessary to use the repositioning sling. To avoid friction and shear on a patient's skin or skin tears, use caution when deflating the support surface and having the patient exit the bed. If the side rails do not lower fully out of the way of the patient thigh, there is a possibility of tearing the patient's skin if their mobility level is such that they cannot raise their backside above the side rail. In this situation, it may be advisable to use patient mobilization equipment. When assisting the patient from bed, ensure the bed is at its lowest position. To reduce the risk of patient falls, instruct the patient to call for assistance before exiting the bed. Techniques to assist the patient from a low air loss surface and/or bed and reduce the risk of fall include using a walker and stool when appropriate, using a bridging technique, log rolling, using a stand-aid device or max assist device such as a floor or overhead lift. Always follow your hospital's safe work practices regarding the proper number of healthcare providers required to complete patient care tasks. For patient and employee safety, always tuck the sling and loops under the bed surface as shown. This will help keep the sling in place on the surface and reduce tripping hazards. Do not leave sling loops dragging on the floor. When rounding on your patient, check the firmness setting of the surface. Do not leave the patient on an overinflated surface. Follow the manufacturer's instructions regarding proper inflation techniques. Deflating the bed surface. Patient precautions to be aware of when having the patient exit the bed.
With some beds that have the air mattresses, if you take a look at what the relationship of the mattress to the rail is, you can see if it's appropriate to deflate the mattress when getting someone in and out of bed from a sitting position or not to do that. In this case, the sitting surface, when we deflate it, actually goes a little below the railing here, and now it's cutting into the leg and can cause friction and shear on the patient's skin, which is not appropriate for this type of bed. But if you have a rail that tucks underneath or gets out of the way from where the patient is sitting, then that may be a viable option to deflate the sitting surface to increase your ability to get the patient closer to the floor when entering and exiting the bed.
Patient posture. Techniques for patient and employee safety when assisting the patient from the bed surface.
One of the issues with any bed surface, a little bit more so with this because of the sling and the type of bed surface that we're on, is the slickness of it. What I watch with that is I'm controlling movement at the patient's knee so that they can't come forward. But the other part of that is if the patient starts to lean back, then that changes the forces that are on here, and it's much easier for the hips to slide out. So it's really important on those patients that don't have a total hip replacement with posterior hip precautions that we keep their trunk forward and keep them balanced there. And I can control the situation very well by using my knees and maintaining the patient's sitting position on the bed.
Using the log roll technique to assist the patient when exiting the bed.
We're going to bend this leg up, bend this one up. Once you keep your knees, hips, and shoulders together, reach over with a hand, reach for the rail and roll like a log. Good. Let your legs come over and push up. Good.
The single leg bridging technique for assisting the patient from the bed.
Number one, want to make sure that the bed's locked before we're trying to get the patient out of bed. An alternative to a log roll, if it's an orthopedic patient with either a total hip or a total knee, would be to use a single leg bridge, which is what we'll show you here. So as we come over, it's easier to get someone out of bed on the side that they had surgery. So if that's an option, I like to do that first, just for body mechanics for yourself and better control of the extremity. If not, we have to egress on the other side of the bed. We can. It just makes it a little more difficult. So to do this, we're going to go ahead and bend your knee up on this side. Okay. You're going to use your elbows into the bed and your left leg. I want you to lift your hips and scoot towards me a little. Right there is good. Okay, this leg's going to come over the edge of the bed. Use that to hook the bed. Push up. Nice. And come on down. Okay, now go ahead and scooch forward a little bit more. Good. And then I would switch sides for this bed to better control as we're coming forward to make sure that he doesn't slide out, if that's the surgical leg.
Additional options for completing off-bed patient mobilization tasks when working with a low air loss surface. Note, for purposes of demonstrating proper patient mobilization techniques, in the clips that follow, we will assume the patient is shorter in height and the bed is as low as it can go. These same techniques would also apply to the patient that requires a higher level of assistance for off-bed tasks than could be completed via vocal or touch cues.
So you're going to go ahead, push down on the walker and step up with your foot. Push up. Good. Bring the walker back. Okay, reach back with the hand. And go ahead and put the seat. Usually I'd have a second person if I'm using a step stool.
Using the Steady with a low air loss surface.
Another way to get into a high bed, if we can't lower the bed surface at all, we'd use the Steady, and we bring them over, get as close as we can, set the brakes. Okay. I want you to go ahead and stand up, pull up. You're going to reach back with the hand and up onto the bed. Okay. Now, while I'm having them sit in here, I'm going to have them go ahead and adjust further back up onto the bed. So scoot your hips back. There you go. That way they can use the height of the Steady to give them a little bit more onto the bed safely. From here, and I'd have a second person to take this away. And move that out of your feet. And then I would come right in and make sure I have the legs securely as we're getting back into bed.
In summary, always assess the patient's mobility level to determine when it is no longer necessary to use the repositioning sling. Consider that a minimum assist level patient may not need the repositioning sling, and to reduce the risk of patient fall, it should be removed. To avoid friction and shear on a patient's skin or skin tears, use caution when deflating the support surface and having the patient exit the bed. If the side rails do not lower fully out of the way of the patient thigh, there is a possibility of tearing the patient's skin if their mobility level is such that they cannot raise their backside above the side rail. In this situation, it may be advisable to use patient mobilization equipment. In summary, always ensure the brakes of the bed are locked. Ensure the bed is at its lowest level when guiding the patient out of bed to reduce their risk of falling. Instruct the patient to call for assistance before attempting to exit the bed. Follow your hospital's policy and procedures regarding the number of caregivers required to complete patient mobilization tasks.